everyone, this is Erika Bennett with South Georgia Medical Center. I'm here today with our president and CEO, Mr. Ronnie Dean. And Mr. Dean, the rise of cases in Lowndes County of COVID positive continues to increase, as well as positive patients that are in the hospital. Can you go ahead and give us an update on what we're seeing here?
Absolutely. Everybody knows, if you're listening to the radio, media, TV, cases are rising. What's different is hospitalizations have risen significantly. You know, Erika, only a few weeks ago we reported that we were single-digit admissions. We also said we really didn't understand why we were low and others were high. Well, I think now we know COVID was here all along. It has now spread to those most susceptible to it, and it's led to an increase in hospitalizations. Today's stats that I'm aware of, we have 72 inpatients today, and although we're discharging up to 10 or so every day, we seem to be admitting one or two more than that. The emergency room is extremely busy with COVID patients and non-COVID patients, and that's a little different than when we were going through our first wave, because if you remember early on, when we had up to 40 or 50 patients early on, we didn't have as many patients coming to the ER. So there has been a significant shift. A lot of intensive care patients. There's a lot of talk about, well, you know, there's a lot of hospitalizations, but how sick are they? Well, they're very sick. 19 of our one intensive care unit is COVID patients, and 6 are on a ventilator. And unfortunately, mortality is increasing. If you're watching our graphs online, you'll see just about every day there's an additional death. I would say COVID is significantly spreading throughout our community. It is impacting those most vulnerable, and we're going to continue to plan for an increase in COVID cases over the next several weeks until we get this thing under control.
And as far as bed capacity, a lot of people are concerned about that. How do you feel we stand in that regards?
Oh, I'm concerned about it. I mean, honestly, we planned. Our clinically led response team did a great job. We set aside, remember we talked about having 90 some odd beds early on. Now again, remember, that's when we didn't have as many non-COVID patients. Remember, we told everybody to stay home. All right, now we've got both, and the ER is back to full force. We were half of our ER visits back then. Now we're full again, complete, because other types of patients are sick and they need to come here. All right, but we're handling it, and I can tell you that we've expanded as our plan called for. Right now we've got 4 units that's handling COVID patients, whereas again, remember, only a couple weeks ago we were using 2. What I think is going to happen is that we're going to continue to fill. We're going to fill to our capacity. We're going to continue to expand capacity. As a matter of fact, we have 40 additional nurses coming. They're trickling in as we speak. Some have already arrived. They're beginning to be deployed to the new units that we're opening. Others are coming. It'll help us not only open new units here, but fully use the Smith Northview bed capacity. And the goal is for us to grow responsibly into our capacity, and then if the demand outstrips our capacity, then we will have to transfer out to other hospitals. We're not there yet. Again, 72 in the hospital. You might say, how many can you take? Not sure. It all depends on what other types of patients we have. But I can tell you the team has done a wonderful job of imagining, planning. Those plans were put in place before COVID. We've enhanced them with COVID. They're meeting every day, and we feel like we've got capacity to handle it for a while longer. But I would tell the viewing public, you know, if this continues to surge, we will be at a point where we won't have capacity. And don't worry about that, because we will make sure you're taken care of in some other way.
So with the increase of COVID-19 patients, increase of regular patients, how is our staff dealing with this?
Erika, they're tired. You know, again, we're built for this, but this is high pace, high speed. And when it's continuous at this volume of patients, now just remember what happens with a COVID patient. nurse and other clinical support, when they go in, they dress out in full personal protective equipment. Then they take it off, and now you're at 72. When we get beyond that, it's more rigor, more demand on the team. So they're very tired, and that's why we're bringing in these additional staff. Something I just want to tell the public, y'all know this, and I'm just an administrator, but I hear a lot of people talking about, oh, it's low mortality. It's not. We come here to help people live. So you can imagine the emotional toll on the staff when there's a death. There was a death just yesterday that the entire team just, it really broke them, because they worked so hard, and unfortunately it happened, and we just cannot be immune to unnecessary death and dying as we go through this pandemic. And I just say that's a personal view of mine. We believe it as healthcare professionals. Hospitals throughout the nation, they work to help people live, and when someone catches this unnecessarily and has an unnecessary, unexpected death, although they may have a comorbidity, it breaks our heart. And so our team is really emotionally tired, but they're strong. They're built for it. They're doing what's required. The community is rallying around them. We get the positive praise. It fuels them, and we're bringing in more help for them, and we're cheering them on. And I just say, everybody, please have them in your mind, those that are at the bedside especially, because they're working hard for this community to save lives and keep us going here.
Yes, we can't thank them enough. It definitely is a challenging time and different times here that we're experiencing, but they are truly rising up and showing their heroic efforts. A little off topic from COVID-19, we are outside our surgery center in our professional building. We have continued to grow throughout this pandemic. Last video, I think we talked about Dr. Mackey, our neurosurgery program, and Dr. Khalil serving patients in that field. But today we have another physician that we brought on this week. Do you want to tell us about?
Yeah, Dr. Sy. He's our newest gastroenterologist. He's one of two that are coming right now. More are coming. He is really qualified with ultrasound use, what's called an ERCP procedure that's needed in this community. Heretofore, we might have had only one or so. He's teaming up with Dr. Castellano. She's in private practice. Dr. Sy works for the institution, but the two of them are manning all of our endoscopy services. He's already very busy. As a matter of fact, he was scheduled to be on the radio this morning. He couldn't because he was in the emergency room. Very proud to have him, and our goal is to bring more like him to the community to meet this unmet need. We really appreciate him. We have beautiful facilities here, as you can tell, easy to get into. Staffing it with well-trained physicians is our goal. No one should have to leave the community or be told you should go somewhere else, and that would be our goal, is for you not to be able to have to leave. And I'm very proud of having Dr. Sy.
Yes, I've heard he's already busy and hit the ground running, so that's good news. That shows there's a need, and anytime we can fill a need for the community, that's
right.
Mr. Dean, is there anything else you'd like to share with us?
Well, again, I want to shout out to our staff, our nurses, our physicians, our volunteers, all of our employees that rally around our clinical teams. They're doing yeoman's work. Someone asked me, how are you doing on supplies and equipment? We do not have a personal protective equipment shortage. The plan was well laid out. We're really good with PPE. We do have a lot of ventilators, and we're using a lot of them. 19 are in use right now. Of our 63, 6 are COVID. We do have beds right now. We may run out of beds, and we're adding more staff. So what I'd convey to the community is please keep these teams in your thoughts and prayers. Y'all continue to rally. Thank you for the food, the cards, the kind comments, and we're going to do our very best to take care of you if you come here, and we appreciate you trusting your care to us.
So there's been a lot of talk about wearing masks and the impact that has on eliminating the spread. While there is an effort for people to wear masks, we know that not everyone has access to a mask.
That's right. Well, fact of the matter is folks can't afford to buy the mask or they don't know where to get it. 300 have come through our drive-through, so we have begun a 10,000 mask campaign. You're going to hear more about it. We're asking the community to get involved, and we're going to secure these masks with donations and funds that we secure from other sources and even from the hospital. We're going to start making masks available. We think masking is the #1 responsible thing anybody can do, especially when you're around, I'd say, the elderly population. I got to say this. All right, somebody says, again, this thing doesn't affect everybody like it affects some, and they're right. But here's the thing. For me personally, I want to do no harm. I don't want to be a harm to anybody around me, so I wear my mask. I went to visit my 86-year-old mom here recently. She's healthy. She drives. She lives in Alabama. The goal for me was to be safe around her. I entered her presence with a mask. When the mask, I washed my hands before. We had a gentle hug. She got to hug her boy, and then we separated and we had our conversation. I'm worried about causing her harm because I don't know if I have it or not. Remember, 30 to 50% of us are asymptomatic carriers or minimally symptomatic. And so I just say the mask campaign is going to help a lot of people help others. And when we talk about wearing masks, it's about protecting others, especially that older population that is susceptible to hospitalization and death.
Yeah, so an easy acronym to remember is WWW, which is wash your hands, wear your mask, and watch your distance. So just keep that in mind as you go out into the weekend. Another thing that we are working on is our convalescent plasma study with our trial with Mayo Clinic that we started way back when we first started seeing patients. And now we know that that is proven to be effective, specifically if patients are treated early with this plasma. And then the thing that we have run into is just availability of the plasma. So we do want to encourage you, if you have tested positive for COVID-19 and you have recovered, you have no symptoms anymore, you can visit a local blood donor center, so Life South or American Red Cross. And if you mention SGMC when you donate, they'll test you to see if you have the antigens that you need, and then they can collect that plasma and make it available for treatment for patients that are currently battling this disease. So just a way you can give back, but we do want to remind everybody of that option.
Please give if you can. Whether you've had COVID or not, give blood. Plasma with these antibodies help save lives.
Yes. All right. Thank you, Mr. Dean. Do you have anything else? Or
No, thank you, Erica. It's a beautiful morning. It's, we're going to get back in and start planning for more capacity, and just thank you to the community for all you do to support us. Thank you for trusting us with your health care.
Thank you, everyone, for tuning in. Have a great day.